Hi everyone, my name is Madison Adams, and today I'm going to be talking about the topic that I did research on, which is targeted cancer therapy. And I wanted to see if it's the best way to kill cancer cells. So let's get started. I just wanted to give a general definition of targeted therapy. It's a relatively new way to cure cancer, and it uses drugs to identify and attack cancer cells. So we're always looking for new methods to cure cancer, and this is something that scientists have put together, have come up with, and instead of attacking normal and healthy cells, it just attacks the cancer cells. Um, sometimes there are, of course, errors with therapy, depending on who you are, how you take the treatment. But overall, it just attacks the cancer cells. So, my main reasons for this research was to fully understand what targeted therapy is and how it works. And I wanted to find out to see if it was the best option for treating cancer. And I also did a little comparing and contrasting with another type of cancer therapy, which is chemotherapy. So, getting started into targeted therapy, there are two types so far of how you can take it. So, you can either take a small molecule drug, which would be like a pill or a capsule, or the monoclonal antibodies. Both methods are effective, and scientists are still trying to come up with ways to have other types of methods on how you could take the targeted therapy, but this is what they have so far, and both methods have worked really well so far on when they've used them. So very effective. So getting into the risks and the benefits, this was definitely a number one thing that I wanted to look at when conducting this research. So when I did find out some risks, the cancer cells, they could be resistant to targeted therapy eventually. So if given too much or if combined with another therapy, the cells can kind of get overly exhausted, we could say, and not react to the therapy any longer. Um, Another risk for targeted therapy is that the drugs are sometimes hard to develop. And going back to the types of targeted therapy, they're still trying to figure out ways to make it easier, make it more effective. Obviously, science is improving every day, so um, they're still looking into different ways. Some of the benefits that come with risk or targeted therapy, block signals that tell cancer cells to grow or multiply. So this is definitely a number one benefit because we don't want the cancer cells growing or multiplying, just the healthy cells. Another benefit is that it can alter proteins within cancer cells that cause those cells to die. So altering the protein, causing them to die, it definitely um, makes a difference with the I don't want to get into this yet, but you'll see when we talk about chemotherapy that it actually works the opposite way. It kills healthy cells too instead of just identifying the cancer cells. So and then another main benefit that I found is that it prevents new blood vessels from forming, and it cuts off the blood supply to your tumor. Getting into targeted therapy versus chemotherapy. Targeted therapy, it affects cancer cells, leaving normal and healthy cells intact. This is definitely the number one difference between the two chemotherapy medications. They can't distinguish between healthy cells and cancerous cells. So the normal cells, they're also damaged with chemotherapy. And this is why targeted cancer therapy is up and coming, it's effective, it's, valued by most people because of how much it works and how it keeps your healthy cells growing and not your cancer cells. So chemotherapy is a good method. The only downside is that it does affect your normal cells as well. When talking about targeted therapy, I have some side effects listed here. Most of these side effects you only have while you're taking the targeted therapy, but some of these effects, they can affect you long term. But starting off, We have some side effects such as diarrhea, liver problems. You can get mouth sores, changes in your skin, your nails. With skin problems, this is probably the number one side effect that most people have had. Most people get rashes, they get scaly skin, red everywhere, but it's that's not a long-term effect. It's not life-threatening. It's just while you're taking the targeted therapy, and side effects, they don't affect everybody. Everybody takes these drugs differently. So really, it's just your personal body, how it takes it and how it will affect you. The main results that I found with all of the research that I conducted was that targeted therapy, it can block cancer cells from replicating themselves, which slows down the cancer production. So this was my number one finding in determining whether this was the best method or not. And I mean, we'll get into it when I talk about the conclusion of my results. But personally, I believe that it's the best option. It's easy to acquire. It's not the most expensive method. It's very, very effective. It has many benefits. I don't The pros outweigh the cons. Whenever I was doing this research, I read about 7 or 8 papers just listing the pros and cons of targeted therapy, and definitely the benefits outweigh the risks. Getting into my conclusion here, like I said, targeted therapy, it has pros that outweigh the cons. Compared to chemotherapy, it's more efficient and it is less risky. Targeted drugs, they often work by blocking cancer cells from copying themselves, which I have stated, which, my number one finding. So this isn't inclusive as the best option by other people, but it is still fairly new. It's still being looked at. The side effect list is fairly long compared to some of the other types of cancer therapy, like radiation therapy or chemotherapy, but the side effects, they're not life-threatening, and they're not, I don't want to say they're not serious, but compared to some of the other types of cancer, the side effect list does not look too bad. So basically, I think that targeted therapy is still being improved. Like I said, they're still working on ways that you can take it. They're still working on, the little, trying to think of the word, like like the wiring of it, of the drug, of how it works. Oh, not how it works. It's overall, I believe that targeted therapy is the greater method to use definitely compared to chemotherapy, solely just because it keeps normal cancer cells alive and can distinguish between the two, unlike chemotherapy. But what I want to do further down the road is look into, radiation therapy, look into targeted cancer therapy in a few years whenever they've done more research and have maybe come up with another way on how to take it, or have maybe come up on how to, we'll develop drugs, but also how to not make your cells resistant to the therapy, and seeing if we can minimize the side effects. So, the results that I found, they were very, very helpful and interesting, and I hope to do more in the future with this. So I hope you guys liked my little presentation on targeted therapy, what it is, how to see if it's a good option for killing cancer cells, and then seeing it compared to chemotherapy a little bit. So thank you, everyone.